So welcome to another webinar session of our technical webinar series on climate change and health. Today we're going to talk about gender, climate change, and health, very important topic. As you can see now, we have the afternoon meeting. We already had a meeting for the morning, and those that have joined us already a few times as part of our technical webinar series know that we always hold our webinar twice per day to cover as many time zones as possible. The content is similar in both, so there is no need to join both, but if you're interested in looking into the morning session, we always upload a recording and presentation on our website. So as you can see, we already had plenty of sessions as part of our technical webinar series. And today we're almost at the end of our webinar series, where we're going to talk about conducting gender analysis for climate change and health vulnerability and adaptation assessment, but also broader, just on the topic gender, climate change, and health. You can scan the QR code or type in the web link to see all the previous webinars we have done and access recording from there. As always, we have interpretation. So right now for the afternoon session, we have interpretation in English, French, and Spanish. You can find the interpretation button in your Zoom. Sometimes it is under more. If it's a little hidden, then you can click on the globe and choose the audio that you would like to hear. With that, also maybe a couple notes on housekeeping. So we have set this up as a meeting, not as a webinar. So you can unmute yourself or turn on your camera if you'd like to speak. But if you are not speaking, we kindly request you to keep yourself muted to minimize background sounds. We have a Slido prepared where we would be really interested to get your feedback because that's going to inform our work and how we can support you better in integrating gender considerations in climate change and health. You can go to slido.com and type in WHOCCH or scan the QR code. And this is, apologies, this is a question. We already had a couple of answers from the morning sessions that you can see here. But we would like to fill it with more answers from the participants now in our session. So feel free to join. We're going to keep this poll open so you can join at any time during this webinar. So no stress about this. So this is the agenda. I'm Yiqi Pan. I'm a technical officer in the Climate Change and Health Unit. And I'm gonna hand over very soon to, you can probably already see her, to Ms. Alia El-Yassir, who's the Director of Gender Equity, Diversity, and Rights for Health Department, WHO. And we will also have an opening from Ms. Miriam Ciscar Blat, who is the head of the Sectoral Cooperation Department of the Multilateral, Horizontal, and Financial Corporation at AECID. Then my colleague Elena Villalobos Prats is going to give the main technical presentation and give us an introduction on the topic gender, climate change, and health, and followed by a presentation by our colleague Rory McKeown from the Water Sanitation, Hygiene, Health Unit in WHO on water safety plans and its relation with gender and equity. Then we will have a panel discussion to talk about some experience from the field. And for that, we have Brama Koné from WHO AFRO, Then Peter Barry from Health Canada and Malala Ranarison from WHO Madagascar talk about their experiences with integrating gender and climate change in health processes. And this will be facilitated by my colleague, Amy Savage, who's sitting next to me. Yeah, with that, Alia first. Okay, with that, sorry. I would like to hand over to Ms. Ciscar Blat.
Thank you very much. I'm going to switch to Spanish since I've been told you have a translation. But thank you. I want to say thank you very much for inviting the Spanish Agency of International Cooperation to be here today in this meeting. Mi nombre es Miriam Ciscar, como ya se dijo, y soy subdirectora en la AECID, jefa del Departamento de Cooperación Sectorial. Y quisiera comenzar agradeciendo a la Organización Mundial de la Salud por invitar a la Agencia Española de Cooperación Internacional a abrir este webinario sobre género, cambio climático y salud. Y para sentar las bases de este interesante webinario, por favor, déjenme comenzar con una visión general de dónde nos encontramos en el mundo. Porque estamos en un contexto mundial en el que alrededor de 700 millones de personas, eso quiere decir 1 de cada 10 habitantes de este planeta, viven bajo el umbral de la pobreza. Y la pandemia de la COVID, que nos asoló hace unos años, pues ha revertido décadas de progreso en todo lo que teníamos avanzado al cumplimiento de la Agenda 2030. Podemos decir que hemos retrocedido y que entre los avances que teníamos, el del ODS 1, que es la reducción de la pobreza, decir que si en estos momentos tenemos 700 millones de personas que viven bajo ese umbral, en 2030 no habremos bajado de los 600 millones, que es una cifra pues completamente inaceptable. Vivimos también en un contexto de crisis superpuestas, con multitud de conflictos armados. En este momento tenemos la invasión de Rusia sobre Ucrania o el genocidio que acontece en Palestina. Decir que 280 trabajadores humanitarios murieron el año pasado en todo el mundo y de esos 280, solo 163 murieron en Gaza, algo que es completamente inaceptable. Además tenemos las crisis naturales que asolan el mundo, como el huracán Beryl en el Caribe, o las lluvias torrenciales del Sahel, o el tifón Yagi en el sudeste asiático, todos ellos muy relacionados con el cambio climático. Y además de estas crisis tan grandes que todos y todas podemos ver, como son los conflictos armados o los desastres naturales, yo quiero hablar de otras crisis que no son quizá tan visibles, pero igual de importantes y muy profundas y además estructurales. Y voy a comenzar con la número 1, que es la crisis de desigualdad entre hombres y mujeres. Al ritmo al que vamos, podemos decir que nos va a llevar unos 300 años acabar con el matrimonio infantil y unos 286 años eliminar la discriminación jurídica que sufrimos las mujeres en el mundo. Como número 2 de estas crisis, querría mencionar también el cambio climático, y que es que si no tomamos medidas para atajarlo, se calcula que en el 2050 el cambio climático empujará a 130 millones de personas más a la pobreza, más de las que ya son, que son muchísimas, y habrá otros 200 millones que estarán obligados a migrar por causas climáticas. La tercera de estas crisis es la crisis sanitaria. Entonces tenemos las emergencias sanitarias como la que nos planteó la COVID o la de Mpox, que estamos luchando en estos días, y también una crisis también profunda, que es la del no acceso a la cobertura sanitaria universal para todas las personas en el mundo. Entonces tenemos que, por ejemplo, vacunar contra la COVID o vacunar contra el virus del papiloma humano supone salvar vidas tanto en los países del sur como en los países del norte. Estas 3 crisis que he descrito aquí son el eje que vertebra este webinario. Son crisis que no entiendes de frontera y para las que cooperar redunda en el beneficio tanto de las poblaciones del sur como de las poblaciones del norte, es decir, redunda en un beneficio global. Y desde la cooperación española, desde la Agencia Española de Cooperación Internacional, nos hemos fijado estos 3 temas como objetivos clave para alcanzar. Son los 3 pilares que fundamentan las estrategias de la cooperación española, aunque tenemos también otros, pero estos son los más preponderantes y que los visualizamos en forma de semana. Por un lado tenemos la luz violeta para los temas de género, por otro lado tenemos la luz blanca para la salud y por otro lado tenemos la luz verde para los temas medioambientales. Tenemos una nueva ley desde el año pasado, una ley que se define a sí misma como feminista y que inspira y permea todo nuestro trabajo que hacemos y que se traduce tanto en una prioridad transversal como en programas y proyectos concretos de desarrollo. Y como hechos son amores, hemos crecido en un 173% el monto destinados a proyectos de género del ODS 5 desde el 2018 hasta el año pasado, hasta el 2023. Dentro de lo que hacemos en temas de género, tenemos una de las prioridades, el empoderamiento político y económico de las mujeres, también con un foco en el tema de los cuidados. Y también porque entendemos que trabajar con las mujeres es fundamental, porque somos el 50% de la población y porque cuando las mujeres mejoramos, la sociedad en su conjunto también lo hace. Otro de los temas claves, ¿no?, que tenemos dentro de este contexto de las 3, de la luz violeta para los temas de género, blanca para los temas de salud y verde para los temas medioambientales, es que dentro de nuestro plan director está muy bien recogido en una triple transición. Por un lado, tenemos una transición social, por otro lado tenemos y económica, y por otro lado tenemos una transición ecológica. Y para apoyar esta triple transición, entendemos que no se puede hacer de otra manera que no sea a través de las alianzas, con el sector privado, con la sociedad civil y con las universidades. Y, cómo no, con los organismos multilaterales. Desde la AECID creemos profundamente en el multilateralismo y en organismos como la Organización Mundial de la Salud, que coordina y lidera la respuesta mundial global en temas de salud, y a quien queremos seguir apoyando de una manera muy sólida y decidida. Esto lo ha reiterado el presidente de Gobierno, lo ha reiterado nuestro ministro de Asuntos Exteriores, nuestra secretaria de Estado de Cooperación Internacional y nuestro director de la Agencia Española de Cooperación Internacional, Antón Leis, en múltiples ocasiones, con lo cual no les estoy diciendo nada nuevo, pero sí quiero poner énfasis en algo que nos marca y que nos define, que es una apuesta absoluta por el multilateralismo. Y voy a poner ejemplos de esto que menciono y que voy a enlazar con estas 3 prioridades. El primer ejemplo es que en un contexto de retroceso en muchos lugares del mundo, la Agencia Española de Cooperación Internacional está apostando, por ejemplo, por luchar contra el virus del papiloma humano. En este sentido, tenemos una iniciativa multilateral, pero también bilateral, para erradicar el cáncer de cuello de útero, que mata a más de 350.000 mujeres todos los años, especialmente en países en desarrollo y en comunidades vulnerables. El segundo ejemplo es que todo lo que hacemos en temas de salud desde la Agencia Española de Cooperación Internacional es el eje prioritario y asciende a más de 122 millones de euros en el 2020. Además, esto significa un 22% del presupuesto de la agencia. Por detrás del presupuesto por detrás de este presupuesto tenemos el 12% que va a temas de género y muy cerca tenemos los temas medioambientales y de desarrollo rural, seguridad alimentaria y nutrición. El tercer ejemplo que quiero poner es el de la acción climática. Y es que en estos últimos 3 años hemos hecho un esfuerzo muy importante por hacer una cooperación más verde, una cooperación que compagina a las personas y al planeta con una visión de una transición ecológica justa. Y desde 2019 hemos incrementado nuestra ayuda oficial al desarrollo climática, pasando de 28 millones en el 2021 a más de 77 millones en el 2020. Otros ejemplos que quisiera destacar, por ejemplo, un proyecto que tenemos sobre cocinas limpias, ya aterrizo en ejemplos así más concretos de proyectos, con el ECRE y que durante el año 22 y 23 hemos apoyado la iniciativa de cocinas limpias con una inversión de casi medio millón de euros, que completa la de otros países como Suecia, Holanda y una iniciativa de la Unión Europea. Ahí la participación de la AECID se centra en el desarrollo del marco regulatorio y una estrategia que va tanto a nivel regional como en países específicos para la implementación de soluciones de cocinas limpias. Esta iniciativa se enmarca en el Plan de Acción Multilateral para África Subsahariana y reduce la dependencia de la región en combustibles biomasa, que aumenta la vulnerabilidad al cambio climático y de la población de las mujeres principalmente, que son las que están cocinando con este elemento que además no beneficia en absoluto a su salud. Bueno, pues aquí tenemos un proyecto que trata estos tres temas: el cambio climático, la salud y el empoderamiento de las mujeres. Como veis, bueno, estos tres temas que rigen toda la acción a veces no están del todo ligados, a veces son proyectos específicos separados el uno al otro, pero cuando hablamos del virus del papiloma humano hablamos de género y hablamos de salud. Cuando hablamos de estas cocinas de ECRE hablamos de género, de cambio climático y también de salud. Y no quiero dejar de mencionar, como iniciativa que marca bien tanto los temas de salud como los de cambio climático, el programa ATACH de la Organización Mundial de la Salud, que seguro se hablará de él a lo largo de este webinario, en el que no me voy a meter por temas de tiempo, pero en el que España está profundamente comprometida. Y ya, para cerrar, quiero decirles que la pobreza tiene rostro de mujer, que muchas veces el rostro es de una mujer que labra la tierra, pero que no tiene acceso al título de propiedad de la misma, y que además no tiene acceso a una cobertura sanitaria universal. Es por ello que la trinidad de clima, salud y género es tan importante. Y desde la AECID, como os he mencionado, nuestro pilar y absoluto compromiso con estas tres temáticas. Muchas gracias y deseo que disfruten mucho de este webinario.
Thank you so much, Mrs. Blat. That was thank you so much for the remarks. Very comprehensive, and thank you for your leadership and also Spain's leadership on this topic. And without further ado, I would like to hand over to Ms. Alia El-Yassir for her opening remarks.
Thank you, and many thanks to the Climate Change and Health team and everyone across the different parts of the world who are joining this important discussion. Thank you, Miriam, for your important scene-setting reflections on the poly-crisis that the world is experiencing and giving some insights into how governments like Spain can address them in an integrated way. I am new to WHO, but I'm not new to the topic. I do come with an ecology and environmental studies background and a long career working on gender equality. So I was particularly interested in today's discussions, and I did join the morning one, and I'm looking forward to hearing additional insights this afternoon. I don't think it'll surprise anyone that the issue of the impact of sex and gender on the health effects of environmental change, including climate change, are still relatively understudied. You're going to hear from WHO colleagues that I had the pleasure of hearing from this morning give a lot of interesting data. But there are gaps in the knowledge, and that's why these kinds of conversations and dialogues are so critical, because they allow us to gain greater insights. In terms of my remarks, and to build on the excellent points already given by Miriam, I would just like to focus on two key elements. And I won't go into as much detail as I did this morning to make sure there's time for the panel discussion. But I do want to talk about structure and agency. What do I mean by structure? Well, I think everybody knows that climate change is disproportionately harsh on those who are already vulnerable. And when we look at vulnerability, we have to recognize that it's rooted in geographic, economic, social, educational, and political power imbalances that are very much embedded in societies and all associated structures. These are things that all of us carry. And through the lens of gender equality, there is this recognition that the imbalances systematically place many women and girls at a disadvantage. And numbers do speak for themselves. We have heard that poverty has a woman's face. I mean, in lower and middle income countries, it's estimated that 70% of the people who are living below the poverty line are indeed women and girls. But we also see it in maybe not the usual spaces. So in the 2004 Indian Ocean tsunami, when we look at the fatalities, women and girls accounted for an incredible 80% of those fatalities. More recently, when we look in a completely different part of the world, when we look at the heat wave that happened in 2022 in Europe, there was a gender difference, and it was estimated that there was 56% more heat-related mortality among women than men. And so all this points to deeply entrenched structural gender inequalities that are based on social rather than biological norms. And for the skeptics about how far-reaching these social norms on gender are, I think I like to share an interesting fact. You know, meteorologists and geoscientists have actually called for greater consideration of social science factors because data shows that feminine named hurricanes cause significantly more deaths than masculine named hurricanes, simply because they're taken less seriously and so lead to less preparedness. So while we talk about natural hazards, they may be gender blind, but the impacts most certainly aren't. And I won't go into all the aspects here because you are going to get it through the subsequent presentations. But we know that more women and girls die from disasters because they are generally poorer, they have less education, they have less access to information and skills needed to survive. Cultural norms related to gender roles can sometimes limit women's ability to make decisions and can restrict their movement. Women and girls tend to depend more on natural resources for livelihoods. And it's also important to recognize the impacts of climate change in terms of socioeconomic instability, political unrest, and insecurity can also have negative gender outcomes, with women and girls being at greater risk of gender-based violence and sexual exploitation, particularly in the context of migration and displacement. You see it in coping strategies. In Cambodia, we have 1 in 5 girls who are married off as child brides as a way for families to cope with increased poverty and food insecurity caused by extreme climate events. So, as you've heard also from Miriam, the world is very far off in terms of its progress towards achieving gender equality by the deadline of 2030. And as you heard, it's going to take almost 300 years, over 280, to remove discrimination in legal frameworks. And if we look at women's poverty, it's estimated it's going to take up at the current rate of progress over 130. When we talk about health consideration, when we're talking about health and the impact of environmental changes and climate change included, there are women-specific considerations, and you will hear about them. But I do want to point to a significant gap. Even though this area is relatively understudied, when effects on women are considered, they tend to be considered in the context of maternal and child health. Of course, this is relevant and it is very important, but this is very narrow of a view of the health of women. And it also risks us excluding men, as well as conditions that are responsible for the greatest disease burden in both women and men. All this to say that for developing effective mitigation and adaptation strategies, we have to improve our understanding of the role of both sex and gender in health outcomes as they're influenced by environmental exposures and throughout a life course. You heard me talk about the heat wave in Europe and the disproportionate impact on women. Well, in this morning's session, I learned something new, that in the United States, you see the reverse trend and with increased mortality amongst men. In terms of mental health, some studies like one done in Tonga show that in the aftermath of disasters, women are experiencing more mental health issues than men. But other studies, one done in South Africa and Bangladesh, for example, show that male farmers in certain areas experience higher rates of suicide during periods of drought. And so when we talk about gender consideration, we really should look at the impact on different portions of the population. boys and men also experience challenges from social norms in the expectations around the fulfillment of their roles and responsibilities. So we really need to also examine the challenges faced by those that don't fall into the two categories of women and men, but those who are gender diverse people who are subject to exclusion and discrimination. There is very, very little information in this area. So it falls on us to take this on. And that's a really important takeaway from my side, because it really looks at examining how there are structural barriers, how we have these barriers within our institutions, programs, mechanisms, and the way we approach the issues. It is complex, it is messy, there is no quick fix, but to truly transform, we must commit to addressing these structural issues. And I will end by just touching on the second element that I talked about, which is agency. Please don't only think about the issues of sex and gender through the lens of vulnerability. Way too often, and in my lengthy career, I've seen women and girls framed as an entirety as vulnerable, which is a disservice to their incredible contributions and their agency. Gender equality is achieved through people-centered approaches and promoting the voice and agency of those who are most impacted. In fact, a recent study found a linear association between gender equality and climate adaptation. So with increased gender equality, we can have better climate adaptation outcomes. And let us celebrate successes like those in Bangladesh, where disaster risk reduction strategies through a whole of society approach are showing good progress and a reduction in mortalities. So let's make sure that we have a diversity of voices and perspective. This is the only way that we can hope to address these complex issues. Use your own agency to shed light on the complexity and to help us all tackle it head on with those who are most affected. So as we have our conversation today, let's please think about the structural barriers, but also about whose voices we need to bring more into this conversation. Thank you all for your dedication to this important work that you're all doing, and I look forward to continuing collaboration. Thank you very much, and back to you.
Thank you so much, Alia, for this opening remarks. And what I could really feel also from Miriam's remarks is that the passion, I could just really feel the passion and the inspiration coming through. So thank you so much. And I think we're all inspired now, and we all want to move to action. And this is where I would like to invite Elena Villalobos Prats to give the presentation, to give an overview of the topic, and also give us some info on the WHO tools that are available to put this into practice. Over to you, Elena.
Thanks so much, Yiqi. And indeed, I think it's going to be a challenge for me to come after the interventions from Miriam and Alia. But I will try to do my best to not be too boring with my presentations. Can you just confirm that you can see my slides in presentation mode?
Yeah, if you could switch the monitors, I think, then yes.
Perfect.
Yeah, perfect.
Okay. So let me go to a basic definition now. I usually hear, and I think it's confusing sometimes to understand the difference between sex and gender. And we sometimes hear people referring to gender when they are referring to basically the biological differences between men and women. So I just wanted to make sure that those key concepts are clear, because basically sex is what defines the biological difference between males and females, and gender is everything that is constructed and is due to historical, culture, and structural issues basically in communities. I think we are all aware of the impacts that climate change is basically responsible for. And this is a slide that we usually like to explain. As you can see there, the health risks are basically the result of the combination of different categories. One is the vulnerability factors that populations and individuals are exposed to. The second are the hazards that are basically mediated through climate change. And then the last category is the exposure. Under vulnerability factors, you can think about demographic factors. It is not the same to be living in a nice apartment than to be living in a refugee camp. So basically, the vulnerability of those populations are going to be different. Geographical, you can think about, for example, a flood-prone area, high mountains, biological factors, pregnant women, and health status of individual. Socio-political issues, we heard about, for example, conflict. Socioeconomic is whether or not you have a formal job, whether you are protected by social protection measures, your income level, and then health systems and the capacity that they have to provide for the treatment and resources that the populations will need. And then, of course, gender and equity issues. With regards to hazards, you can see there the different things that we usually mention: extreme weather events, heat, sea level rise, air pollution, vector distribution, ecology, water quality and availability, and then, for example, food systems and agriculture, and how changes in climate through all of those are going to also mediate some of the health impacts that populations will be impacted with. In terms of exposure, I think the most relevant for the discussions today is the one on people and communities, and again, how the different vulnerable factors, starting from gender, will determine the different exposure and how the different populations and individuals basically will be more vulnerable and susceptible to a specific health risk. So when we think about gender, basically it is clear that weather and climate affect everyone, everywhere, in all continents, in all regions, in all countries, but not in the same way. I will not go too much into the examples because I think Alia and Miriam already reflected on some of the gender considerations with regards to health outcomes. Maybe just to give a little bit more of an example, if we think about vector-borne diseases, we need to understand that how people work and how people basically live will determine how much they are exposed to the specific risk. So if you think about mosquito biting times, if women are working outside or if men are working in the fields outside, they will be more exposed to these mosquito bites and therefore to the specific vector-borne disease. At the same time, we know that some biological factors like pregnancy will make women more attractive to mosquitoes because their body temperature increases with pregnancy. So basically, this will also determine that they are more impacted by these infectious diseases. There is another example that I'm sure my colleague Rory will maybe refer to, but basically there is some evidence in Bangladesh about women, pregnant women, suffering from preeclampsia and hypertension due to exposure to salinization in water. So basically, due to sea level rise, the water sources are becoming saline, and basically this is affecting the health of women. Maybe just another example of mental health issues. I think when we talk about gender, it is also important to understand that, again, there are certain norms and roles that will determine how the different populations and individuals are impacted by this risk. So in the case of mental health, there is evidence in Australia and in India of men committing suicide because basically due to drought, they are not able to provide financially for their families. So there is this social preconception that men are supposed to provide at all times. And then when they were seeing that they were unable to do so, they felt the social pressure and basically committed suicide rather than seeking for support. And of course, as I think it was mentioned also by Alia, the few evidence and data that we have looking at different impacts in extreme weather events is pointing at a major impact among women. So all this needs to be better assessed. I think something that is important for WHO is to make sure that these gender and equity considerations, and I'm happy that you will have the privilege to hear from Peter Berry, because he's very knowledgeable overall on climate change and health. He has been collaborating with WHO for many years, also to develop the methods to assess climate change and health vulnerability, which is a guidance that you can see there. And something that we are promoting is that gender and equity issues are integrated into this climate change and health vulnerability and adaptation assessments. Basically, with this, we try to support countries to understand which are the interlinkages between climate change, health at country level, and to identify which are the priority health risks that they would like to focus on. So basically, for us, we think it's important to do a gender analysis when conducting these climate change and health vulnerability and adaptation assessments. And gender analysis for us is basically the process used to ensure that gender considerations are taken into account within programs and policies or the conduct of these climate change and health vulnerability and adaptation assessments. And I would like to just present on these slides on gender norms, roles, and relations. Probably so already clear after all of the interventions, but when we think about your gender norms, I think when conducting a gender analysis, it's important to understand whether these norms are, for example, dictating mobility restrictions among, for example, women, because again, there is evidence showing that during extreme weather events, women in some cases and in some contexts have had to stay at home waiting for others to come, and therefore unable to put themselves to seek for protective measures. Same with decision-making, participation, and access to information. So basically, it's very important to understand whether these norms and roles are determining different access between women, men, boys, and girls. And the same for roles and relations, who does what spaces do men and women usually occupy, and what are acceptable interactions between them. So we think that there is a tool that we published very long time ago, 2012, on integrating gender within climate change and health adaptation programs. And then we have tools to support interested users to conduct a climate change and gender and health analysis, basically. So there you will find this tool, basically allowing you to think about the biological factors, socio-cultural factors, and access to uncontrollable resources that will basically determine this greater vulnerability in specific individuals and population groups, and also health-related considerations that will also determine these health risks. So there you should consider things from health-seeking behavior, experiences in healthcare settings, health and social outcome and consequences, and access to and use of resources. And the same potentially about risk factors and vulnerabilities. We also have questions in this tool trying to help you think about the issues to be considered. And then we provide checklists around the 4 phases of a project. So identification, formulation and design, implementation, and monitoring and evaluation. And again, always linking back to these vulnerability and adaptation assessments and to the specific interventions that we from the climate change and health community are promoting at country level. Within those checklists, we structure all of our recommendations around 5 categories: local context, target population and participation, health communication, data and indicators, and human resources, technical capacity building, gender responsive budgeting. Before I go further ahead, I would like to make an important point. I think that is the lack of sex disaggregated data and age disaggregated data. So when trying to prepare for this presentation, I was trying to find more updated examples of differentiated health impacts between women, men, boys, and girls, and it's really difficult to find this data. And I understand that is a problem because countries, they are requesting to disaggregate data by many things. But when we don't have the information on how people are impacted, it is really difficult to address solutions that will protect these populations. So I think we all have the responsibility to promote that the data is gathered in a disaggregated manner, at least looking at sex and age, and that it is reported in the same manner. So from WHO, I think we will take on board the responsibility to try and promote this at country, but also within our partnerships, and maybe the attach that Miriam was referring to is a good avenue to make sure that this is promoted also. We'll not go into too many details. Maybe, again, there are things that you can get into in this guidance. I think I would just stop under implementation because probably this is the most concrete things that we can refer to. Something that is probably very important, if you think about human resources, of course, we want to train the health workforce. We want to have enough health workforce that is trained to identify and to address the health risks from climate change. But I think something that is also very important when it comes to gender equality is to value the contributions from everybody. Something that I've seen in the field is that women are usually involved as volunteers. And of course, this is maybe great, but women are already holding the burden of many responsibilities that are usually not recognized nor valued and not considered as real contributions to society. And when you put a value, even in financial terms, to the contribution that women can do, including as community health workers, for example, it really has an impact at community level. So when we design projects, when we implement projects, we really need to find a mechanism to value this contribution rather than just overburdening women with unpaid and unrecognized contributions. Something else that I would like to highlight is, for example, as an implementation, as an intervention, just this example of HIT early warning systems. This is a neutral, gender neutral reflection. We don't need to be specific here, but when at country level, we already have identified a threshold for a heat wave and an alert is submitted to the Ministries of Health, we need to have enough information on how people are exposed, how people, whether men are running outside or whether women are going to be going to collect wood for, or we really need the data to understand how to tackle the different vulnerability that the different populations are going to face. So if all men are isolated, or if older women are isolated and are not going to be able to access this warning, then we will not be able to tackle the problem. You will have this, something that is coming, and I will not go into details. It's another tool that will be hopefully allowing us to update the current guidance that we have to integrate climate change and health within specific programs. On this, we are looking specifically to guidance for countries to qualitatively gather information on specific climate sensitive health risks. So what you see in the slide is an example for malaria. So again, this is to support countries to do focus group discussion on the topic. We will also be further developing indicators that can be considered for these climate change and health vulnerability and adaptation assessments. And as WHO, we want to make sure that we work across the different departments. So we'll be making sure that this happens, because as of next year, all WHO will be promoting climate change work within their interventions. Lastly, bad on my side, because I really like this slide. You see the woman, you see like 3 generations trying to decrease both to tackle the climate change and the health burden that we have nowadays. They don't wear a helmet, but we will paint those in the next slides that we use. But again, I think this is linking back to the Alia's point before about the agency and how different populations can be part of the solution. If we individually commit to implement solutions that will tackle both the climate crisis and the health burden caused by climate change, we will also contribute to our own health. So for example, if you commit to active transportation, if you're a woman, you will have a high chance to decrease the osteoporosis problem that we will potentially be facing, but also to reduce the mental health and burden that we may be facing as we live. So just my last slide is very brief. You will have this. Within our programs and projects, we should aim at least to be gender specific, but ideally gender transformative. And something that I forgot to mention, for this to happen, we really need to be looking at our budgets and to make sure that there is a budget line to make sure that gender equality and health equity are integrated into our programs. This is everything from my side. Over to you, Yiqi.
Thank you so much, Elena. Thanks for the presentation. Since we're a little bit over time, but of course this is a very important topic, I'm gonna hand straight over to our colleague, Rory.
Okay, thank you very much. Just 1 second there. And hopefully you can see my slides in presentation mode. Okay, thank you all very much for your attention. So I will be talking a little bit around another tool that can be considered for essentially strengthening the resilience and equity of safe drinking water service delivery through water safety planning. So I'll talk a little bit about some of the key principles and benefits of water safety planning for those of you who may be less familiar with the process. And I'll talk about how the water safety plan framework provides a robust and systematic way for mainstreaming considerations on climate change and also equity. So a lot of these issues have been touched upon already, so I won't delve into them too deeply, but in the context of safe drinking water, equity and enhanced resilience, many challenges, disadvantaged and vulnerable groups face increased health and security risks and of course burdens due to climate-driven water scarcity and degradation of water quality. Now, the impacts are well documented and can exacerbate the existing inequalities that are currently limiting these groups' access to safe and adequate water supplies. And as a result, there can be increased risks of water-related illness with the adverse social and economic impacts. So although the challenges are many, there is also significant opportunities. So to be considering and giving meaningful consideration and participation of these groups in processes for safe drinking water management can greatly improve public health outcomes, reduce inequalities, of course, and also improve livelihoods and well-being. So for those who are less familiar with the concept, water safety planning, it's a proactive and systematic risk assessment and management approach that considers all steps in a drinking water supply. So from the catchment right through to the consumer. Now, water safety planning is recommended in WHO's framework for safe drinking water as one of the most effective means of consistently ensuring the adequacy and safety of drinking water supplies. Now, the approach, it's flexible from lower to higher income countries in urban, rural, and smaller water supply systems, as long as the approach is tailored in order to suit the resource and capacity constraints in any given setting. Now, how WSPs work is really by firstly understanding the complete water supply system, so every stage within the water supply, identifying vulnerabilities, so how and where problems could arise. We'll talk a little bit about how these vulnerabilities may be linked to changing and uncertain climate, and of course then how these vulnerabilities might affect different user groups within a water supply system. This enables a assessment and prioritization, which allows you to focus initially on priority health threats. So this way you can get the best return on investment in terms of public health protection. And a critically important step then is and management systems in place that proactively manage these risks. So not just waiting until a problem has occurred and trying to figure out what went wrong and how it went wrong, but to be constantly monitoring the water supply system and making sure that the barriers are functioning as intended and that all users of the system are receiving safe and adequate water supply. And lastly, but most importantly, from the perspective of climate and equity, the need to involve all stakeholders concerned with safe drinking water management in the process to ensure that there are equitable benefits derived from the outcomes of water safety planning. Now, there are many benefits to the process documented in the literature if water safety plans are applied successfully and sustainably over time. I won't go through them all. I've just included a short selection here, but just wanted to focus in on how water safety plans can support readiness and of course, recovery in emergency situations. This can include, natural disasters, but also climate threats such as floods, drought, bushfires, and also how it can be applied as a framework for more equitable water service delivery, which is very much in line with the SDG agenda of ensuring that no one is left behind. Now, we do have recently published the second edition of our Water Safety Plan manual just last year. And this reflects over a decade of practical experience since the first edition was published in 2009. Now, between 2009 and 2023, WHO published supplemental guidance with a particular focus on climate resilience and enhancing resilience through climate resilient water safety plans, but also specifically on equitable water safety planning. So what the second edition of the WSP manual has attempted to do is to streamline and integrate the key messages from both of these publications. And there was a misconception that, for example, climate resilient water safety plans were something separate to your standard water safety plan, and perhaps that equitable water safety planning was additional work on top of your water safety plan. So we wanted to, dispel those misconceptions and make sure that people understood that both climate and equity, which of course includes gender considerations, is really an integral and should be considered holistically in the water safety plan process. Now, these 3 publications are very much still alive. The Water Safety Plan Manual simply makes reference to these 2 other publications where further information is needed, but making sure that those key messages are integrated clearly and visibly on both climate and equity. Now, we're all, I'm sure, aware of the many impacts of a changing and uncertain climate on water supply. I won't go into the details other than just to make everyone aware that it affects every aspect of safe drinking water delivery and service. So from water supply, demand, through to water supply infrastructure, critical assets, day-to-day operations and maintenance, and emergency response planning, and most importantly, the user level practices, so collection, safe household water treatment, storage at the household level. So I won't spend too long on this, but just to make the point that at each stage of the WSP process, I've shown the 5 stages here that are common to both urban and rural or small system water safety planning. There are opportunities to consider climate within each of these stages. So firstly, in terms of preparation, there is an opportunity for the water safety plan team to supplement its expertise. You know, water safety planners are generally not hydrologists, and they're not disaster risk reduction experts. Okay, they're not climate and public health experts. So it's important to supplement the team with the knowledge that allows the next step to be conducted through the climate lens. So to understand what the current threats are in the system with regards to climate change, and also then to understand and get the climate information to help water suppliers plan how projected changes in climate might affect vulnerabilities within the system. And this allows then a robust risk assessment and prioritization to be done, and implementing a progressive improvement plan to try and strengthen the resilience of the system to the identified vulnerabilities. Now, from a monitoring perspective, it's important these are flexible and adaptive. For example, more monitoring may be needed during flood events or during bushfires. It's not possible to transport samples to a central laboratory, so field test kit provision needs to be made. And under management and communication, particularly around emergency response planning for the anticipated climate events that should be experienced or are expected to be experienced. And lastly, then, the WSP process is kind of a living, breathing approach. It's not just a document that sits on the shelf. So as new climate information becomes available or other operational experiences, these need to be reviewed and the water safety plan updated to ensure this continuous cycle of improvement. And just to give as much for a mental break as everything, but just to give you a rough idea of this in practice, this would be an example of a water supply system schematic that would inform water safety planning. And through this climate lens, and we can overlay with climate information, for example, the increase in rainfall, where we can spatially look at which assets are currently in a flood zone and which assets are likely to be affected by flooding based on current climate projections. You can consider what household practices are being done during floods and what alternative water supplies may be needed. So through this process, it's possible through a kind of a multi-barrier approach to look at the different steps of the water supply system and where adaptations may be needed. So this example table here shows a scenario where there is increased drought and water scarcity. And we can, through this process of assessment and prioritization, identify improvement measures, for example, at the source, looking at supplementing existing water sources to meet capacity, can look at distribution level for reducing water losses, and of course, at the household level, educating users and households on safe water conservation during drought periods. So We can also then overlay this assessment with our equity perspective. So vulnerable and disadvantaged user groups, it's critically important that they are explicitly and meaningfully considered in the WSP process. Now, water safety planning can support these tangible improvements for the full diversity of water users in the system. Now, the illustration here on the right just gives an example of some of the diversity of user groups that may need to be considered to ensure equitable benefit from water safety planning. So everything from the type of service users receive, be it a piped connection or a tap stand, through to disability, and of course gender, and looking at income, education, age, and there are many other examples. But what's in practice for water safety planning to be truly equitable, it's important that all of these diverse user groups are given the opportunity to meaningfully participate, and that the risks experienced by all groups are identified, and improvement and management plans are targeting benefits for all users within the system. Now, to give an example of this in practice, we can see here how users of a public tap stand in an informal settlement would face very different risks than water users with a continuous piped household connection. Okay, there's obviously additional risks from microbiological contamination of the water collection vessel, right through to how it's handled, stored, and treated at the household level. And as been touched upon already, you know, women and girls very often in some contexts are responsible for this water collection, and this brings tremendous challenges and disadvantages for this group. So all of which needs to be robustly considered through the water safety plan process, through meaningful contribution and participation within the process itself. Sorry, I'm conscious of the time here, so I won't spend too long on this, but just to give some examples of how equity can be practically considered and applied in water safety planning. We can look at how users in informal should be explicitly considered in the risk assessment that can be very often forgotten. You can recognize the need to compensate stakeholders that might be adversely affected by improvement measures. So, for example, if there are certain restrictions on catchment activities for drinking water sources, this could be fisher people who are relying on, fishing in a catchment for livelihood, or it could be people that have businesses for washing clothes or washing cars or other types of vehicles, or industries. You know, if you're looking at introducing these restrictions, you need to be considering how these barriers and control measures affect these user groups, and what compensation or other control measures should be considered. Another example is considering vulnerable parts of distribution networks in monitoring programs, and importantly then, and through the climate aspect as well, to be developing emergency response plans that consider the needs of different groups. So we've touched upon how these emergencies affect different user groups in different ways, you know, and you could also the added dimension of people that might have mobility issues, which have to walk long distances to a water truck in the event of a prolonged outage. There might also be people that are visually impaired, and also people that simply can't afford access to certain communication technologies. So I will leave it there. I've already discussed a little bit about our guidance on water safety planning and our documents with a specific focus on both climate and equity. And just to flag, this year we have published our guidelines for drinking water quality that are tailored to small water supply systems, which include rural settings. And this can obviously help to address disparities between access to safe drinking water from urban and rural settings. But we also include a recommendation on the move towards professionalization of the management of drinking water supplies. And in many cases, women and girls can be tasked almost in some cases by default by being their own water supply manager, be it for the household, be it for a community water point or otherwise. So the shift towards professionalization is hoping to address some of these disparities and challenges that different user groups experience. So I'll leave it there. There's a QR code for more information and to download any of the publications that we've discussed. So thank you very much for your attention.
Thank you so much, Rory, for this very clear presentation, and thanks for sharing the guidance. I think that's always very helpful for participants and those who are watching the recording. You can see that my colleague Amy has already posted some guidance in the chat. Since both you and Elena have mentioned tools, we would like to share the Slido again, and just to remind you that we welcome your feedback on how would you like to be supported on integrating gender in climate change and health. And I will now pass over to my colleague Amy to moderate the panel. We have a wonderful panel, and she's going to introduce them and tell you all about it.
Hi everyone, most of you know me, but my name is Amy Savage and I'm a technical officer in the Climate Change and Health Unit here at WHO. And we've heard a lot of content in the last hour or so, and now we get to hear from a few experts on their experiences with implementing and integrating gender into climate change and health work in their specific contexts. So as Yiqi mentioned at the top of the webinar, we have 3 panelists. And I can't see now if you all have your videos on, but I ask you if you can turn on your videos, and I'll introduce. We start with Brama Koné, who is a technical officer in climate change and health at the WHO Regional Office for Africa. And then we have Peter Berry from the Climate Change and Health Office of Health Canada. And finally, Malala Ranarison, who is from the WHO Country Office in Madagascar. So I'll get right into it because we are a little short on time, and I will start with you, Brama. So Brama, from your experience in the Regional Office for Africa, could you share some of the ways that you've seen that countries in the region are integrating gender considerations into their climate change and health processes, plans, and interventions?
Yeah, thank you so much, Amy. I should say that after the presentation of Elena, things are quite easy for me and will go quite straightforward. Yes, as WHO, what we are doing mainly in supporting countries, help those countries to build their strategy and actions in terms of integrating gender in the climate change and health activities. As you may be aware, since the COP26, the international community came out with what we call health initiative, COP26 health initiative. And this initiative is calling countries to build a sustainable and a resilient health system. And to do so, WHO has been working for decades on tools to guide countries' member state actions. And I think the presentation made by Elena came a bit on those tools to support countries draft the vulnerability and adaptation assessment and draft the health national adaptation plans. So when we look at how the vulnerability and adaptation assessment are guided, are made following the guidance of WHO, they start by setting a plan, an assessment plan with a team to do the assessment, with the questions countries want to target for this assessment, by putting in place a stakeholder consultation process. And in all of this stage, at each of this stage level, putting in place the team, gender consideration are already integrating in setting the teams that will be doing the vulnerability and adaptation assessment. Looking at the questions that have to be targeted, that have to be answered, the issue of gender is also considered in this. And we are not only looking at gender equality, we are mainly looking at equity effectiveness when it comes to gender. It's not a matter of giving to all gender group the same things, but giving what the group needed specifically to make them reach the best state of health when it comes to climate change impact on the health. So yes, through our VNA support and through building health national adaptation plans, we try to integrate gender issue at the higher level in countries, and that can be seen finally in the activities that are undertaken in each of those countries. The second component, the second action I want to rely on, where we are also supporting countries to integrate gender consideration, is through building the nationally determining contribution of countries. The NDCs of countries, we are supporting countries to get healthy NDCs, to get national determined contribution that are health related. And by doing so, we make sure that those countries, while implementing the action point, while implementing the activities to reach their NDCs, we make sure that those activities are gender related and are considering gender issue in the implementation process. So these are two main ways of moving forward with our member state in the African region that help countries consider gender issue while tackling climate change impact on health. And I will stop there. Over to you.
Thanks so much, Brama. Yeah, really useful to bring up the VNAs, where we hope to identify some of those differential impacts of different genders of climate change on health, and also the NDCs, which I will just mention, we are publishing a new guidance on integrating health in the NDCs that will be launched at COP29. I will move on to Peter Berry now. Canada has shown really great leadership when it comes to gender mainstreaming. In Health Canada's vulnerability and adaptation assessment, there's an entire chapter dedicated to health equity, where several determinants of health are considered simultaneously. So I have a somewhat complex question for you. Well, it's got several parts. I'll try and summarize. But Peter, could you elaborate on what intersectionality is? What are some of the benefits of considering gender, but alongside other factors? What are some of the challenges and complexities that arise from considering intersectionality? And also, what are the costs of not doing so? I hope you got all that. And I understand that you do have some slides as well to make it a little bit less complex.
Yeah, thanks, Amy. Thanks for the opportunity to be here and really to learn from all of the presentations and remarks. So in Canada, in our national health assessment, intersectionality is really understood as a complex and interdependent interaction between various individual identity factors, sex, gender, age, language, ability, as well as social norms and cultural practices, institutional processes, and really systems of power. And so it really allows you to identify existing power dynamics in society and to move beyond individual factors. And so you can really better understand situations of disadvantage that make it harder for people to protect themselves and their families from climate change impacts on health. There are a number of benefits associated with considering gender alongside other factors with respect to intersectionality. And one is just, generally you improve health equity in society. And we know that resilience is built with more equity and health equity in society, but also you develop much more health adaptations in terms of changing individual behaviors by addressing things like patterns of power in society, individual characteristics, but also the social conditions that can provide obstacles to people to taking action. Now, there can be a number of challenges in terms of doing some of this analysis. They've already been mentioned by some of the speakers. So, things like important data limitations if you don't have that disaggregated data to do some of these analysis, even gaps in the research in terms of linking gender with climate change, but also even a limited trust between, say, health sector officials and diverse populations, gender diverse populations, and so you need to build up that trust, and a way to do that could be through conducting climate change and health vulnerability assessments, and certainly you really need community engagement and diverse voices to do that, and that can take time and it can take resources, and so that's something though that can be really quite helpful. So there are again many benefits, but there are also some costs in not undertaking this type of analysis. So certainly the biggest cost, I think, is less effective adaptation measures. But even worse, we could actually, with our adaptations, with even our greenhouse gas mitigation measures, we could increase inequities in society if we're not careful, and if we don't have those diverse voices and do the required analysis, which is really quite important. So in Canada, we do have evidence that, for example, women with challenges in terms of mobility challenges or disabilities sometimes have barriers in terms of accessing healthcare, and so this is really important when we build climate resilient health systems, when we improve emergency management and whatnot, when we improve the health the information systems and train staff. We need to take these kinds of considerations into account where they're relevant in terms of building those resilient health systems. Thanks.
Thanks so much, Peter, for that comprehensive response, and also for raising some of the costs of not considering gender and other intersectional factors, particularly when we're trying to do something maybe to fix one problem and instead we may be contributing to something else inadvertently, like increasing inequities. It's a good point that we should be keeping in mind. For the sake of time, I will move on to Malala, and then I've got follow-up questions later if we have time to get back to them for all the speakers. So Malala, Madagascar did conduct a vulnerability and adaptation assessment, I think it was in 2015, and now you'll be embarking on conducting a new iteration and updating that VNA. So do you have any advice on some initial steps that you and your team will be taking to make sure that gender is integrated from the very beginning of your VNA process?
Yes, thank you, Amy. Yes, as you said, Madagascar is going to update its VNA assessment this year. And yes, we are going to integrate a gender approach in this assessment for this year. So there are some key steps we have identified in this proposal. And the first one is to ensure that decision makers in the line ministries are aware of the importance of gender approach in this assessment. It means that we have to advocate at the level of the Ministry of Health and the Ministry of Environment to ensure that they agree the fact that it should be integrated in this assessment. And also, luckily, Madagascar has already a national strategy on gender and climate change. So maybe it won't be too hard for us because we'll just implement this national strategy. The second step that we will ensure to be implemented is to work with a gender expert or gender specialist of what the process of this assessment, because this person will ensure that the gender approach is really integrated at all the stages of the assessment. Another point is that we also have to ensure a capacity building of the members of the technical team in charge of of the assessment, because that will ease the process and that will help us integrate gender in all the processes, starting from the development of the methodology and the tools that will be used for the assessment. We'll also have to ensure that gender is integrated during the situation analysis, and there are tools that are already available, as the one that were presented by Elena. We can use these tools when we are making the situation analysis to ensure that the gender approach is already integrated since the beginning of the process, and then it will be easier for us for data analysis and the writing reports to integrate gender if it is already integrated, starting with the situation analysis. And another point is also to ensure that not only gender approach is integrated in this VNA assessment, but also in the adaptation plan, the national adaptation plan, that will be another product from this VNA that will be conducted in the country. Thank you.
Thanks so much, Malala. And I think a really important recommendation for countries just getting started is to make sure that there is a gender expert on the team, because as we know, VNA requires quite a broad team depending on all the different health outcomes and the data available that your country will be looking at. So including gender right from the beginning is a really important recommendation. So we do still have about 8 minutes for this discussion. I have some follow-on questions, but I would like to first open it to the floor and see if there are any questions from our audience that we can pose to the panelists. So if you do have a question for any of our panelists, raise your hand, or if you don't feel comfortable speaking, you can put it in the chat. If I don't see any hands raised, I will move on to my follow-on questions. But if there is anyone in the audience that would like to ask any questions. Well, while we wait for that, I will move on to my second question for Brama. If you could try and answer in 1 to 2 minutes so that we could keep to time. Brama, would you be able to provide some examples of some specific climate change adaptation or mitigation actions where different risks and vulnerabilities as a result of gender have been specifically addressed in those actions?
Thank you so much, Amy. As I was saying in the first part of my contribution, countries are being supported to implement gender-sensitive actions through starting by the planning process, through the VNAs and the HNAPs, and also through the NDCs. If you look actually at the VNAs that has been done in the African region for the last 15 years, we have almost 26 VNAs that has been done. When you look at all those VNAs, being disease-targeted VNAs or not, the gender issue are considered and analyzed. And from those VNAs, the health national adaptation plans that came out are also gendered, and so that we consider the gender effectiveness in the actions that have to be implemented in countries. When you look at the NDCs, 40 out of 41 African countries that have submitted their updated NDCs for the second generation of NDCs, I would say, that were submitted by 1st August, by August 2023, they all included gender considerations. And among the 40, 34 were including gender consideration in relation to adaptation, when 27 were referring to gender in relation to mitigation. And some specific actions that seek to empower the women through the access to resources, training, skills were observed in 21 countries and NDCs. Having said that, while a lot of activities implementing in Africa are related to adaptation and mitigation, they are mainly, they are still targeting, I would say, energy, water resources management, and agriculture sectors. And so far, few are based on the HNAPs that are coming on. Few are actually, were actually until now health related in terms of direct health related. Why? Because so far, the funds that were available at the international level to support adaptation in the health sector were highly missing, were highly lacking compared to other sectors. Health is now coming on board with concrete actions, with concrete agenda and concrete financial support. And from there, we hope to see more and more activities in countries that will be directly related to health issues. Having said that, we have been also supporting countries to implement disease early warning and response systems. And when you look at the actions that are made when it comes to specific diseases, climate change is exacerbating the risk factors and then is increasing the risk of those diseases. And when it comes to adaptation actions to control those diseases, we are not coming to new actions. We are empowering already existing actions. When you took a disease like malaria, in almost African countries, all African countries, where we have malaria control programs, malaria is well known to be a gender disease. Young children and women are the most vulnerable to malaria. And all countries' malaria control programs are already implementing activities that are well gendered. So when climate change is coming on board, increasing the burden of malaria diseases, the actions that are already on ground are supported to be more impactful. So we are not coming with new strategies. We are making our gender actions to be more reinforced in countries. And then countries are already experiencing WHO support to make this happen. If I take a second example, a disease, and I will stop there. If you look at
so much, Brama,
yeah.
we only have a couple of
Wonderful.
minutes
That's
left,
fine.
so
So let's move forward with it.
Yeah.
Yeah, over to you, Amy.
Thanks so much. And I have just one follow-up
welcome.
question for Peter. I do understand that the Canada VNA looked at upstream drivers of inequity, and upstream drivers that differentially affect women, men, or those that don't identify as either. And I was wondering if you could expand a little bit on some of those upstream drivers.
Yeah, so there are a number of really important upstream drivers, like social and cultural structures. Oh, thanks for the slide. Colonialism, but also climate change, and these can and do impact the status of really important determinants of health, such as gender, which we know in Canada, and we've heard from others today, really can increase risk from health impacts from climate change. And then certainly this can mediate health impacts by affecting the sensitivity, exposure, and really importantly, the adaptive capacity of individuals. And so you can sort of trace how these various drivers ultimately can impact health. And then the really important part of this is what we do in terms of adaptation within the health sector, but also outside the health sector. And this is why these assessments and the guidance from the WHO is so important, and these examples, because the type of research that we do and the type of engagement that we do with many populations can make sure that our health adaptations are most effective in addressing a lot of obstacles that people do face. Thanks.
Thanks so much, Peter. So we are at time, but I think we might, if it's okay with the panelists, I mean, if you're not available to stay, that's fine. If you're able to stay for another 5 minutes, we do have a couple of questions from the audience. If Lena Goyle would like to ask, if you'd like to open your mic and ask your question. Lena, I don't know if you're still there. Oh, yeah, I can see you've unmuted. Go ahead.
Thank you for such an insightful session. I had a question on how we can integrate gender-sensitive approaches in climate resilient systems. So the low resource settings at primary level, like the primary healthcare level, to ensure equitable access to all the vulnerable populations during climate-induced emergencies.
So I'm not sure if any of the panelists would like to take that question. Brama, Peter, or Malala?
Oh, please
Yeah,
go
please
ahead.
go ahead. Yeah, please go ahead.
No, I was just gonna say that I was having a bit of difficulty listening, hearing the question. So perhaps go ahead.
Thank you. If I hear very well, the question is how she was asking how to consider gender when it's come to emergencies management. I think if I got it globally. I would say it depends on the kind of emergency. We have so many emergencies that are related to climate change. It can be disease emergencies. You may have a cholera outbreak. It may be a flooding event or a drought event that is causing death of people, and that we may want to look at. So depending on the specific emergency, when you look at the heat emergency, for example, that we have been facing in the African region, in the West African region, a country like Mali has been facing this year, 2024, a heat stress that has never been faced so far. And we got more than 100 people that were killed. And those people were mostly elders. When we got the information we got from the country, those people were mostly elders. So when we were requested to support the actions that were suggested is related to guiding health workforce, because those elders, many of them were farmers, still going to doing farming activities, and we came out with a suggestion, with guidelines, with recommendations to protect those elders and not go and work under the sun, to change a bit their working time. So if this was related to another activity, to another emergency, let's say cholera outbreak, where we are facing with water quality, the targeted people and persons will be the women who are in charge of going and fetching for water, who are in charge of water conservation in families, so that they keep the water conservation tools more clean and protecting from any pollution. So yes, it depends on the kind of emergency we are facing. The kind of emergency will design the kind of gender consideration to implement. This is what I can add, but I hope I got clearly the question, and this is the answer I can share with you. Over.
Thanks so much, Brama. We have reached time. I see there is a couple probably answered by that response from Brama. There's one about thinking about climate risk for young people, and of course, when we're looking at climate risk from this intersectional lens that Peter was talking about, age would be one of the other factors that we would consider in this kind of VNA. So I would also recommend having a look at Canada's VNA, because they did a very, very comprehensive job looking at all the different intersectional risk factors, not just gender, but how they interrelate, as Peter explained. So with that, just because we really are over time, I will go ahead and close the webinar. I want to thank all my panelists. Thank you very much. It was a really informative and interesting panel, and I thank you for your time and effort to be here today. Thank you for all the presenters that came previously, and I think we've all got a lot from this webinar, a lot to think about, and thank you to all the participants for your engagement, for staying with us for a little over an hour and a half. and we've shared some resources in the chat, and we hope to continue, well, we will be working on this issue of gender and other equity issues going forward in climate change and health. And so I'm sure we'll all meet again soon. Thank you very much.
Thank you.
Thank you.